visual off. So this meeting is being recorded now, and you can have the option to leave or continue. I think you might have gotten a prompt. Wonderful. So thank you. We're going to be doing these webinars over the next few weeks. And without further ado, I'm going to pass it on to Tim. Tim, you are muted. So
I am. We'll get the hang of it one of these days, won't you? Thank you, Emily. Thanks everybody for being here with us this afternoon. I'm really glad that all of you took time out of your day to join us. We'll be doing a presentation today, myself, and actually most of it, Sarah Philbrick, my colleague in the Data Services Department, talking about what we call the COVID-19 layoff housing gap and the work that we've done over the last month to understand the nature of the economic crisis that we're facing right now and how it's affecting workers and their households all across Massachusetts. No one has to be told how unprecedented the crisis is right now and how challenging it is for many of our neighbors and our colleagues and our families who are out of work or seeing reduced hours, very concerned about their health. And what we're trying to do is use the information that we have available to help cities and towns and stakeholders and legislators to understand the nature of the issue better, figure out how to make solutions so that we can take care of all our neighbors and all folks in Massachusetts as we find our way through this and move back towards recovery. As Sarah will get into in the presentation, I think what we all know is that there have been an incredible number of layoffs that have hit some industries particularly hard across the country and here in Massachusetts. And like the economic crisis, or like the public health crisis, has been inequitable in terms of who has been infected by the novel coronavirus and the racial disparities that we're seeing in the health issues. There's also important disparities that we're seeing in the economic impacts of the situation we're in right now. And I think one important thing is that as we dug deeper into understanding what those economic impacts are, we also could see that they really relate to a lot of long-standing economic trends that have to do with wage polarization, housing instability, lack of affordable health insurance, and a number of other issues that predated the crisis we're in right now. So while our focus for this particular piece of research is on the situation that's happening, that's happened over the last 4 weeks, it really helps us understand better the cracks in our society and the cracks in the economic security of many of the state's workers that have been longstanding, and that this may provide us with an opportunity to address some of those things as we figure out how to deal with the current crisis right now. So just by way of background, as you can see on the slide, a little bit of background for the work. More than 500,000 unemployment claims were filed in Massachusetts between March 16th and April 11th. So folks have probably seen the number of 22 million for the nation, 500,000 here in Massachusetts. It's equivalent to, we estimate, about 16% of all employed wage earners in Massachusetts. Fortunately, the Federal CARES Act was signed into law late last month that expands unemployment benefits, both in terms of the dollar amount as well as it covers independent contractors and extends the insurance to folks who aren't even employed or might be looking for work, and then also provides one-time direct payments of about $1,200 per adult and $500 per child. So a considerable amount of federal assistance coming, specifically to individuals. Is it enough? That's an important question. Will it last long enough? That's another important question. So what we try to do with the research that we've been working on for the past couple of weeks is understand who's affected by the crisis, which workers, what are their households like, how will it affect their ability to pay for housing and other needs, does the CARES Act help to close the gap, and then what happens, who's left out, and what happens in a couple months when those expanded federal benefits expire at the end of July. And we released an initial report on this on April 2nd, and then we've collected a couple more weeks of unemployment data for the 2 weeks following that, and then also looked at some other issues that folks had raised then. So today we've released an expanded report, which you can find on our website, and the URL will be at the end of the presentation. But right now I'm going to turn it over to my very capable colleague, Sarah Philbrick, who's really leading the technical work on this, who's going to walk you through the findings and some of the key implications, and then we'll come back for discussion and questions. So Sarah, why don't you take it away?
Great, thanks, Tim. If you start thinking of questions in the middle of the presentation, feel free to put them in the chat, and we'll try to moderate those later on, and then we'll also prompt you with a few of our own questions at the end of this. But like Tim said, some of you may have seen our report that we've released on April 2nd. We've updated that report, but also expanded it to look a lot more at these policy questions that Tim just highlighted. So I first want to start just by looking at the scale of unemployment claims by industry. So this chart shows each industry by NAICS code in Massachusetts. On the y-axis going up and down here, we have the share of the industry that was filing for unemployment, so the share of all workers in that industry before COVID-19 who have filed. And then on the x-axis, we have the share that industry had of workers before COVID-19, so sort of how big that industry was. And then the size of the bubble actually indicates how many layoff claims we've seen so far. So if all of the layoffs were distributed equally, you'd sort of see every bubble going along a one-to-one line here, but we see that there are some industries that are much more effective than others, such as accommodation and food services, which not only has a big bubble, but is also high up on the chart, showing that, that there's a huge share of that industry that's filing for unemployment. Same with personal care, repair, and other services, and construction. Those are some of our hardest hit industries, not just by size, but also by share. And this chart shows a similar story for occupations. So we estimate, as Tim said, that about 16% of all pre-COVID-19 employment is now someone filing for an unemployment claim in Massachusetts. And you can see that there are some occupations where it's much higher than 16%. Again, food preparation and service occupations are about 32% of all folks in those occupations likely filed for unemployment in the past month. 28% of folks in construction occupations, and about 21% of folks in installation, maintenance, and repair. So there's a huge impact across the whole economy, but there are definitely some industries and occupations that are being hit harder than others. This chart shows the total claimants that we've seen estimated by occupation. As a total, again, you see the same occupations that we just showed in the last graph, showing some of the biggest numbers here too, but office and administrative support coming in as the second highest number of claimants, and folks working in transportation and moving operations. So we estimate that for all of these claimants, they represent about 440,000 households that have at least one worker filing for unemployment. There are some households that are experiencing multiple workers who have lost their jobs, and some that have just one, but that's a lot of households impacted across the state. These households are more likely to be low or moderate income households. We estimate that those earning 15,000 to 75,000 are disproportionately impacted by these layoffs. Laid off workers are also, due to the occupations that are most laid off, younger than the total workforce, specifically under the age of 30. We estimate about 30% of workers who are laid off are under the age of 30. And laid off workers are more likely to speak a language other than English at home, again, due to the occupations that we're seeing the most layoffs in. We estimate about 71% of laid off workers receive health insurance from their employer, which has huge implications for what folks do after layoffs. Expanding that insurance through COBRA is really can be really expensive. Filing for mass health can be complicated and expensive as well. And there's just a lot of folks right now who are trying to figure out what they can do. That doesn't mean that these workers didn't have health insurance from another source as well. There are a lot of folks out there who have sort of combinations of health insurance, but that's still a pretty dramatic number. Job losses in the top 5 laid off occupations we estimate would reduce a household income by an average of 57%. So any sort of layoff in a household across the state, as you can tell, would have dramatic implications for the household income of that household. And we estimate that without any sort of assistance, including unemployment assistance, there would be nearly 300,000 households that wouldn't be able to cover their housing costs and basic needs, including healthcare, transportation, and food without any government assistance. So luckily, there is some government assistance, which we'll talk about in a minute, but we also, as Tim mentioned, really were struck by how many households were already on the edge of financial distress as we started looking at this data. We estimate using an MIT living wage calculator that the average household would need to spend at least $7,440 per person per year for basic needs. Again, this is food, healthcare, transportation, does not include childcare. And we wanted to know how many households already probably couldn't reach this threshold of the basic needs and their housing costs per year. And we found that 11% of all working households were likely unable to pay for their monthly housing costs and basic needs before COVID-19. For renters, this was 22% of households, or 21% of households, excuse me. And for households that had a food preparation worker, this is 22% of households. So a really staggering amount of households already struggling before the COVID-19 layoffs, who were forced to make difficult decisions about what bills they could pay that month, what they should be spending money on, going into debt, or relying on other types of assistance in order to meet those basic needs. So as I said, luckily the CARES Act does provide some moderate improvements for some households. The current program offers 50% of pre-layoff wages as your regular unemployment, or what we're calling regular unemployment, plus a $600 a week added benefit. So any worker who is making less than $62,400 a year before the layoffs is actually seeing an increase in their income. We estimate this is about 62% of all eligible workers across the state who would receive more through this expanded unemployment benefit than they would beforehand. So this sort of shows how big of a gap there was in people's wages before. If we think this is, the right amount of money for folks to be able to cover their basic needs, there were a lot of folks who weren't able to reach that before. And many workers who are still currently working in essential positions are actually receiving less income than they would be if they were otherwise unemployed, which not only shows sort of the value we're putting on those essential workers right now, but also makes it very difficult for folks who need more workers right now to be able to hire anyone. So again, the CARES Act, as Tim mentioned, really does provide immediate relief for most folks who are able to access it. The one-time payment, in addition to the expanded unemployment benefits, the one-time payment being the $1,200 check that you hear about in the news, provides relief for almost all households the month of the check. It leaves about 1,700 households still in need of housing assistance, totaling 2.3 million across the state. After the one-time payment, even with the expanded unemployment benefits of the extra $600 a week, there's over 11,000 households across the state that we estimate will need $10.2 million monthly to make ends meet. And this is a lot of households. It's slightly less actually than before those expanded unemployment benefits. But the impacts they have are really disproportionate across folks who are laid off. So this chart shows the household composition of all working households on the left. Households with a child are in blue. Households that are more than one person without a child are in purple, and then single person households are in pink. And you can see that all laid off workers look similar to all worker households. So the folks who are laid off are about a similar share of folks with children. But then if we look at households who would need assistance, even with the expanded unemployment benefits, they're predominantly households with children who really need this extra help. And we see a similar story about folks who speak a language other than English at home. Folks who speak English only at home are in purple, and our other languages are in the colors on the top. And all laid off workers are slightly less likely to speak only English at home, but then when we look at the households who need assistance, even with expanded unemployment benefits, you see a dramatic change in the composition of those households. And actually, a majority of them are households that speak a language other than English at home. These impacts are also disproportionate across workers by race. We have in purple Hispanic Latino workers, blue is Black non-Hispanic Latino, pink is Asian Pacific Islander non-Hispanic Latino, other race, and then the white non-Hispanic Latino workers are in gray here. And we can see that the majority of the workforce in Massachusetts is white non-Hispanic Latino. As we get to all laid off workers, they're disproportionately, workers of color are disproportionately impacted by layoffs, but they're much more disproportionately impacted when we look at workers who need assistance beyond that unemployment benefit, where we have 50% of all the workers who need that assistance are workers of color compared to just 27% of layoffs. And so I think these three charts show that, you know, folks who are already sort of vulnerable in our society are the ones who will be left out and need extra help compared to what the federal government is providing right now. And if we don't make up that gap, these disparities will just get worse over time. And we know from other research that has come out in the past few years, folks of color, folks who don't speak English as a first language, are less likely to have savings and potential family wealth that they're able to pull on in times of a crisis. So I think that shows the amount of help that workers who are able to access the CARES Act would need. The CARES Act, you can tell, really does provide quite a bit of relief, but there's also quite a few households that are ineligible for the CARES Act. Not all affected households are able to receive government benefits, particularly undocumented workers, but also potentially workers with irregular or seasonal income. We're still looking into the way that the CARES Act is being rolled out and who's covered, but the majority of folks who are ineligible will be undocumented workers. We estimate that undocumented workers or anyone ineligible for the CARES Act would need approximately $1,400 per household or $725 per worker per month in order to make up for that gap between the income they have and what they need to pay for housing. And based on an estimate from the Pew Research Center that came out in 2016, that undocumented immigrants comprise 5.1% of the Massachusetts labor force, we estimate over 30,000 undocumented workers in the first month of layoffs would need approximately $22.3 million a month just in housing assistance to avoid eviction or foreclosure and meet their basic needs for food and transportation. So as Tim mentioned as well, we're interested in what happens when the CARES Act ends. The expanded unemployment benefits expire at the end of July, and standard benefits are much lower than these expanded benefits. Standard benefits are 50% of your usual take-home income. And we find that that would be insufficient for about 30% of impacted households to make ends meet. That total estimated gap is $144.3 million monthly. And that's just with the folks who have already filed unemployment claims. We know that there's a lot of folks who still have not filed, and until last week or a few days ago, folks who were self-employed were not able to file. So we'll probably see a rise in filings again next week when we can see that data. And then we really don't know what recovery looks like. We don't know how fast folks will be able to return to work. We don't know if their jobs will be there. We don't know what the economy looks like. We don't know what jobs are safe to return to. So we are doing a few different analysis to sort of see what would happen under different scenarios of what it looked like for folks to go back. This is one that we've shown right here that says that if 40% of food preparation and sales workers and 15% of all other workers are still out of work, when the CARES Act is expired, that would be over 31,000 households needing $34 million monthly. And again, we don't really know what this number is because we don't know what will happen after, in August. But I think what this research shows is we have some tools to estimate what need might be under different scenarios. So moving forward, I think one of the biggest takeaways is that we need to make sure that the implementation of the CARES Act happens as intended. We know that 30% of folks would need help, of households would need housing assistance if they didn't have access to that $600 a week. So we need to make sure that folks have access to it, that folks are able to file for unemployment, especially self-employed folks who otherwise wouldn't have been able to. And we need to make sure that money is actually getting in the hands and bank accounts and pockets of people. We also can tell that the need for housing assistance likely goes beyond the capacity of existing funding or aid programs that already exist, especially at the municipal level. Most municipalities just don't have this kind of money on hand to help people with rent or mortgage. Recently passed state legislation that prohibits evictions and foreclosures sort of only pushes that need to pay rent and mortgages further into the future. So if you're receiving back pay and you're just waiting for an unemployment check, that might be okay. But for folks who are seeing a decline in income or folks who are ineligible for federal assistance, you're really probably not going to be able to make up for that lost rent or mortgage payment. There's immediate relief needed for hundreds or tens of thousands, of undocumented workers who are most vulnerable to evictions and other instability right now because they're not able to access federal support. And as Tim mentioned in the beginning of this presentation, I think our research also highlights that this pre-COVID economic system wasn't working for many folks and couldn't protect most workers from a major shock. There's so few workers who have the ability to save over time or even make their basic needs before this. And so we need some long-term solutions in order to raise wages and improve financial and housing security in the future so that if and when another economic shock happens, we're less concerned. And I think, this economic shock has happened across the entire country, so there is federal action, but I don't want to wish it on anyone, but if something happened just at the state level, we might not see that kind of federal support, and we need to be ready to make sure that folks have the stability they need. So as Tim mentioned again, we have an updated and expanded report out today on our website here, and we'll be posting the webinar slides later as well. And I think we can turn it over to Emily to field some questions.
All right, thank you for that, Sarah. So we would like to open up for discussion, questions. I have seen some comments in the comment box. If anybody would like to unmute themselves and ask a question, I could also take a look if you would like to raise your hand. Yeah, okay, Renee.
Hi, how are you?
Good.
I'm from New Bedford, Mass, and I am currently the director of the New Bedford Cheerleading Program, which is a anti-gang youth violence prevention and intervention program. And we are part of the Executive Office of Public Safety and Security here in New Bedford. So our workers are considered essential, even though they're not essential. But they're out there doing the outreach portion of it. They're doing the outreach and working in the community on the front line, but they're independent contractors. And I am out there working with them as well. But there's no talk of any type of extra incentive, like monetary pay for them, anything that's monetary that they'll get extra, because they have families too, but they're still, willing to be out there and put their self on the line and put their self in the front lines in order to keep peace in our community, because youth violence has risen since this has all happened, and we're trying to prevent death. So I'm just trying to find out, my question is there an opportunity for them to, I don't know, other than the stimulus, get anything from the CARES Act? I know people don't, because they're not considered first responders, but in my eyes, they're second responders because they're always there when there's a criminal act that's committed. And they do the work that a lot of other people won't do, and they're still putting themselves in harm's way. So is there any way for them to have any relief? Because if they're out one day, they don't get paid for that day. So, and sometimes they have to be because they have children, and if there's no child care or nobody to watch them, they have to stay home, so they lose out on pay. They don't get benefits, they can't go on unemployment. So I heard you speak about that, so I was just wondering if that is something that could pertain to them as well.
Yeah, I should, I guess, note first that Tim and I are definitely not experts on the CARES Act, but we have done some reading into it. And from what I understand, the current CARES Act does expand benefits for folks who have to, not just folks who are unemployed, but folks who have to miss work due to an illness or taking care of a family member, and they can apply for unemployment for those lost wages even if they're not technically unemployed. But they would definitely, again, we're not experts on the way the CARES Act works, so we definitely have to look into that more. I don't know, Tim, if you have other thoughts on that.
Well, I think, Renee, I think it's a great question, and I really want to thank you for the important work that you and your colleagues are doing in New Bedford. And it is essential, and it's unfortunate that it's, that there's not, really hazard pay provided for that. While the CARES Act did extend those the unemployment benefits to independent contractors, I don't know, I'm not sure if those family medical leave benefits are extended as well, but that is certainly something that I think we can raise with our government affairs team. And we work with youth violence prevention organizations in the Metro Boston region, and I think we can sort of bring that forward to the folks who are working with Beacon Hill as they're thinking about sort of other assistance and support that needs to be provided during these trying times.
Thank you.
Thank
Great.
you.
Thank you, Tim. Leo, I see that you have a question, and then Andre after that.
Hi. I'm having a little bit of trouble understanding the timing or trying to correlate the timing with unemployment, which I would assume began in the first week of March. And we're in the second or third week of April. And so a lot of people have already missed payments, are already out of cash, I would assume. And or is this the case? I just saw what I see is huge numbers of people who, as far as I can tell, are already broke. Is this the case, or am I not understanding? And there's been distribution of benefits from the CARES Act and also the extended unemployment.
Well, the time period that we're looking at starts, it's claims that were filed between March 16th, which was the day, basically the Monday that the kind of stay home orders really went into effect, and a lot of folks started working from home, and a lot of the non-essential businesses were required to close. So that it goes from March 16th to April, 21st? Is that right? So it's a 4-week period, or rather April 11th. So it's the 4-week period, and really the unemployment claims spiked in that week of March 16th. So that's really where that was where we went from a few thousand unemployment claims every week in Massachusetts to 157,000 the very first week. So that's what it covers there. I mean, one thing about the CARES Act is that the benefits are retroactive to the date that the person stopped working. So even if it does take a couple of weeks to get the claim filed, it should be retroactive to the date they stopped. And I believe that that's true for the independent contractors, even though they've had to wait to file their claims as well.
So to some extent, what this depends on is that the landlords will not evict people until they do in fact get cash in hand, and people do find ways of making ends meet until in fact they do get cash. again, has some cash or money been distributed already to those who filed immediately? I'm just trying to understand the timeframes.
Yeah.
Go ahead, Sarah.
Yeah, that's very true. I mean, the eviction moratorium that we have in the state right now does prevent folks from being evicted, but if they're not able to pay rent. So hopefully those landlords are waiting for folks to get the back pay that Tim was talking about. And to be honest, I only know about folks, how quickly it takes for, or how long it takes for folks to get their unemployment claims based on friends who have filed. And I know that people who have filed a few weeks ago have started receiving checks, but I think it's different. It's different depending on what paperwork you have and how quickly you were able to get in those claims. And so I know there is money being doled out already, but I'm not sure. We don't know what percentage of folks who filed claims are seeing that money right away.
Great.
Can I just, if I can just add one thing on here, which I think is an important question, is that, we did the analysis assuming that the program works, as intended and as well as it could. And I do think that there is a very valuable question here about what's not working about the program and who has to wait an inordinate amount of time, and what are the barriers to folks to filing and to actually claiming those benefits. I think those are really, really important questions, because theoretically, if you can get the benefits, you're fairly well covered. But we know that it's probably not working as well in reality as it does in theory. So one thing we're interested in hearing from folks here and in the coming weeks is, what are the stories and what are the examples that we're hearing about the ways that the program's not working, and how do we make sure, what can be done to improve the functioning of the unemployment program, and then also fill the gap for folks who can't access those benefits.
Great, thank you, Tim. I have two questions here on how the numbers are broken down. So one from Stephanie Cokes, do you have the need broken down by percent of AMI after counting unemployment? And then Andre asked if you'd broken down the numbers by municipality.
So we don't have that data available right now. We didn't do it by AMI, but we did look at household income. So we can release that, or if you follow up with us, give you that. I think because it's at the state level, AMI is potentially a little bit less useful. And so I would probably be encourage us to release the data by household income totals instead, just because of it, AMI depends on where you live. And then unfortunately, right now, we don't have claims by industry at the municipal level released from the state. And this is a question we get a lot. We've had a lot of municipal partners really want more detailed level data so that they can help the municipalities they serve better. So we are working on some advocacy with that right now, trying to see if we can push to get data released at a more fine geographic scale. But right now, we just don't have claims by municipality.
Great, thank you so much. And then Philip and Kate both thank you for the data, but also wondering if you could break it down by female heads of household. So I'm just going to share that comment. And then Joanne, you had a question?
Yes. Can you hear me?
Yes.
Great. Hi, Emily. Hi, Sarah. Hi, Tim. It's Joanne. I'm tuning in from Chicago, and it's just great to hear back from MAPC and about this data. I think I joined in a little late, so I was wondering where the data was taken from and the time period it was collected. That could be the first one. There's a follow-up about it.
Yep. So the claimant data, or the unemployment claims by industry that we have, start in March 16th and end at April 11th. So we're looking at a 1-month window of unemployment data. And then the information we use to estimate what that means for the demographics of households in certain occupations and the housing costs and things like that are actually 2013 to 2017 American Community Survey microdata. And we've adjusted those rent costs and other other housing costs to 2019 dollars. It's a little wonky, but that's where our data comes from.
Great, thank you so much. It's just because I live in Chicago now and was wondering if I could just do like a small cross analysis for those resources so I can disseminate it to my community members as well to see what the parallels. Thank you.
And there is, for folks who are interested in the details, there is a methodology document that's available on that website with more details than on how the numbers were created than are in the report itself.
I'll make sure to check it out. Thank you, Tim.
Great, thank you. I see Priscilla had a question. Andre, thank you for answering that. Let's see, Mike Romano, did you have something to add?
Hi, I just wrote my question there, but I'm happy to say it out loud. I work for the Valley Opportunity Council in Chicopee and Holyoke. I'm an advisor in our adult education program. A student came to me who said she was having trouble paying her rent. Her work hours were not eliminated, but severely diminished by the crisis. At first, I didn't think she would be eligible for unemployment because she hasn't been in the country very long. But it looks like the CARES Act opens the eligibility to people who don't have enough employment hours under their belt to normally qualify for unemployment. So that could be very helpful to her. And I'm aware of the RAFT program, Rent Assistance for Families in Transition. But I was wondering if there are any other resources that she could turn to maybe help her meet her rent obligations in the coming months. Did you hear me?
Yes, yeah,
Okay.
definitely. That is a good question. I think we are not experts in the particular sort of client-focused resources that are out there, so I don't want to venture a guess on that. I'm wondering if there. I know there's, we have a lot of folks on the line, and I would love to hear from people who are in the audience who might have an answer for Mike, because I don't want to venture anything from my ignorance on the topic.
Of course, thank you.
I will say, so maybe folks can put that in the chat if they have any ideas. I will say, I think, the situation that Mike just raised, I think is a really troubling one, which is the folks who might actually be hit hardest by this are people who were already being paid relatively low wages beforehand and then haven't been laid off, so they can't file for unemployment, but their hours have been reduced. So they're working less, so they have less income, but they're not working zero, so they can't claim unemployment. And I think those may be folks who are really stuck in the middle here. And unfortunately, it's very difficult to find data on the number of hours worked. We're gonna keep looking into that issue, but that's a piece of the puzzle which is not really addressed in the information we've shown you today, but I think is something that I'm quite concerned about. Emily, who's next?
Thank you. So Bailey brought up a question about the impact on families with children, especially single parent families that might still need to go into work, but have to, do childcare. Is there any information on that? This is Bailey Werner, if you look into the comments.
Yep, it looks like, Bailey, you did bring up that the Family Medical Leave Act has expanded to cover situations in which people need to take care of children who are now at home instead of at school or childcare. To be honest, that's really the extent at which I know about that policy, and I don't know the limitations of that, or if there are situations in which folks aren't covered. So we looked at the estimated number of folks who, as you saw in the chart, estimated number of folks who were laid off and who need housing assistance, who have families with children. I think, there was a question about householders, female-headed households as well, and maybe I think what the person was trying to get at that maybe was single parenting. So maybe we can do some more analysis on the estimated number of single parents who would be impacted, but in terms of the actual resources out there, I'm not super familiar with those.
Great, thank you, Sarah. Is there anyone else that has a question or a comment to add to the discussion? You can either, raise your hand digitally or put a comment in the comment box. I think there's lots of follow-up conversation here from Mike's earlier question. Yes, Mark, you can unmute yourself. Thank you.
By municipality, but we really don't have data by industry, by municipality, so we can't get a sense of how many of our employed workers have been let off because they work in restaurants or in the food service trades, which would be helpful to give us a sense of who this is impacting in our town. Is there such a database that we can get more granular notion of notions of unemployment in a given town?
Yeah, so that's exactly right. I mean, we don't have unemployment for each municipality, unfortunately. Even totals, let alone by industry. There is data out there for employment by industry before the layoffs through the Executive Office of Labor and Workforce Development, and so if you want to assume that layoffs happen proportionately across industries across every municipality, I think we could, you could estimate some numbers of layoffs based on that. If all, across the state, if 20% of food service workers got laid off, and how many food service workers were in your municipality, you can make some big estimates there. And I think that's when we've been asked to do this for a more granular scale. We're working on a project right now with Cambridge, Somerville, Everett, Revere, and Chelsea and Salem and Beverly actually just joined that project as well. And so we're estimating layoffs based off that, but it's really an exact science.
Information, I'm intrigued by Timothy's mention that their work is impacted because their hours are reduced, and that may put them on a very marginal sort of scale of being able to cover their costs. And is there any way that we can get information on that, how that is differed across industry?
Yeah, that's a question that I think we're going to have to pursue with Labor and Workforce Development, since they collect all that, the wage and unemployment data and hour data, hours work data from employers, at least for wage employment. They don't do it for self-employed workers, but they do it for wage employment. So I think we can try to get a picture there. It usually takes a long time for those more detailed data sets about wages and hours and so forth to kind of move their way through the process. So I think there's, going to be a need to try to have them accelerate that. Often there's, the most current just even employment statistics by industry that one can get at the town level are nearly a year old at this point. So, I think we do need to try to accelerate that process at the state level so we can get a better picture of what's going on without having to wait 6 months or so.
All right, is there anyone else has a question or a comment?
I guess.
Yes, Mark, again.
Yeah, I guess you really didn't speak about whether you think this is going to be a V-shaped or a U-shaped recovery, and how we approach that if we're trying to meet emergency rental housing needs.
Well, I don't think anyone can answer that. I mean, I'm not going to speculate on whether it's V-shaped or U-shaped. I think, or ends up sort of bottoming out and recovering very slowly. I think there's a lot of scenarios for the way that might take place. Our next step of this work, I mean, in addition to, trying to address some of the questions you have here, is actually working on looking at, different economic recovery scenarios. And Sarah started to look at what some of that might look like in her last slide, or the second to last slide. What if some industries are back to work, or some occupations are back to work, but food service folks and people in the accommodation industry takes them much longer to come back, versus something where all sales people are also still out of work for long periods of time. So I think we're going to try to test out, create some of those scenarios and look at what it would look like for long-term, unemployment benefit demand, as well as housing assistance needs, and try to understand that further. Not with the intention of predicting what it's going to be like, but understanding what policies will be needed or might be needed as the situation evolves, and being more aware of, what will be needed under different pathways will hopefully provide us with a way of getting out ahead of those things, and getting ready for the recovery, or just having policies more suited towards a slow recovery, if that's what we're looking at.
Great, thank you. We have a question here from Nathan Robinson.
Hey there. I want to thank MAPC for all the work that you guys have put into this on behalf of, I think, many people on the line. As somebody who's working in local government and we're trying to kind of wrap our heads around what it is that we're dealing with, I think that you guys have done a phenomenal job in just trying to sort of wrestle this thing to the ground a little bit, and it's a great place to start. So I just want to commend Tim and the team at MAPC for all the work that you guys done. I think it's phenomenal that you've been able to get this out so quickly. So thank you.
Thank you.
Thank you so much. And Paige had a thoughtful comment that she wanted to put forth. Paige, did you want to say something?
Hi. Sorry, let me get on here. I've been running around. Yeah, so this sounds like I don't even know how to bring it up, but basically I got a stimulus check, which was great. I mean, who doesn't want money? But I've been paid to work, and I feel somewhat guilty that I got this money. And so I've been trying to figure out what to do about that. And I actually think I found a family in town that I want to actually give a big chunk of it to. I know they've been laid off, but anyway, my point being is I'm wondering if anybody's heard of it, if others feel the same way, if there's any direct way to help folks. I just heard the gentleman talking about the girl who couldn't pay her rent. I mean, again, we're not talking a lot of money here, but it just feels like there's a lot of us maybe that might be in this position. And I just didn't know if there was anything happening on that, if anybody's heard anything. Because it just really feels like there's been a very big despair, those of us who are quote unquote white collar, whatever, that were fortunate enough to work from home, we're being paid. And I mean, I actually, until today, I've been having a great time. Now I think a month home is making me nuts. But, I know that's not the case in so many instances, and I would love to just find a way to pay it forward, but I really want to do it in a way that it doesn't go to just some organization with executives, where it actually would make a difference. So anyway, that's just a thought I had. I'm looking at all the comments.
Yeah, I think there's some great ideas in the comments, and a lot of neighborhoods and a lot of municipalities have had residents sort of create these mutual aid funds where folks can give money and request money, and those have been set up really, really quickly. And so if you're looking to, do some sort of small network give back, I think that's a place for that. There's also a few organizations across the state and across the country who are redistributing stimulus check money to undocumented workers who were not able to receive that money. So I would look into that. But I mean, I understand that feeling, but there's also a lot of folks out there who are still being paid to work, but also have zero savings because of the economic system we've been in for the past, multiple decades. And so I definitely have been encouraging folks to give back, but also having folks understand that paying, to make yourself a little bit more resilient is also a good place to start.
On the mutual aid topic, I'll note that Massachusetts Jobs with Justice has an inventory of these local mutual aid networks on their website, which is massjwj.net. And and those are places where, folks are donating and coordinating the distribution of those resources within their own community and their own, or even their own neighborhood, in order to help out neighbors. And I think it's very, it's refreshing and very heartening to see all of these efforts emerge in a time like this. And I hope we can find ways to leverage that and move towards more systemic change, so that we're not, having to scramble and create these things in times of crisis, but actually those networks and those social safety net exists long before we're facing a crisis like the one we have today.
Hi, this is Helene Flexer. How are you guys today? First of all, I want to thank you for the presentation. And I just wanted to say that what I've been doing is, I also feel guilty about getting a stimulus check as well. And I have been at local nonprofits in my area. We have a local church group. Municipalities are also trying to, at least in Connecticut is where I'm from, we're housing homeless people to be able to space them out, because the shelters don't have space to accommodate the 6-foot socially distancing. So you can actually give money to your municipality to fund hotel rooms locally to be able to house people in your area. So the things that I was my money, and I've spoken with a couple of groups, church groups and faith-based groups and nonprofits, to make sure that money is going directly to service people who either are homeless or who didn't get a stimulus check or aren't getting their unemployment benefits. So I hope that's helpful.
Thank you so much. And I think with that, we're going to close today's webinar. Thank you so much. It was a nice way to end, I know, a heavy topic that we will be continuing to look at. Thank you for everyone's comments, everyone's questions. We will be posting this presentation. If you visit mapc.org, we have a section on COVID resources, and hopefully we can also collect some of those websites, donation and fundraiser pages as well to share. Tim, Sarah, did you want to have one last word before we close it out?
I want to thank everybody for joining us today and for all the good questions and conversation. And please let us know if other things come to mind, or if you, any way we can help you in the important work that's going on in your community and all across Massachusetts. We are looking for opportunities to help put this data to work, and so please feel free to reach out.
Thank you so much. It is very useful when we hear if something is helpful, resources that we can pull together. We are going to be continuing these webinars and changing up the topics. Next session will be on May 6th, also Wednesday, 2 o'clock. We're going to focus on virtual meetings, public participation processes, really trying to get up-to-date information on legislation, on town meeting and whatnot. And so hopefully by then we'll have some facilitation, best practices on public engagement, also an update on what municipalities are doing around the region. And then the following Wednesday, May 13th, we'll have some resources regarding supporting small businesses. There's lots of information that we have there. Again, please visit mapc.org. We're constantly updating all of the information that we have. It's changing weekly, and we appreciate your time and your attendance today. Hope you all have a wonderful afternoon and stay safe. Thank you so much.
Thanks, everyone.
Thank you all.
Thank you to our presenters. Thanks.